If you're considering starting a ketogenic diet to treat mental illness or psychiatric symptoms, you may want to prepare ahead of time with tips to make it easier. I'm Dr. Bret Scher, Director of Metabolic Mind, a nonprofit initiative of Baszucki Group, sharing information and research at the intersection of metabolic and mental health. At Metabolic Mind, we have the privilege of working closely with numerous experts in the fields of mental health and nutritional ketosis. We have a more detailed video with many of the experts giving their top tips to help you set yourself up for long-term success. You can watch the full video here, but if you want the summary version, well, then you're in the right place. But first, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. So consult your healthcare provider before changing your lifestyle or medications. All right, now, so here are some of the top expert tips for starting and maintaining nutritional ketosis for mental health. First, from Harvard-trained psychiatrist Dr. Georgia Ede, transition slowly into ketosis. A slow transition helps reduce keto flu symptoms, and it can make it safer if someone's taking blood sugar or blood pressure medications. Dr. Ede mentions that it's sort of less of a shock to the system, and in her experience, it sets her patients up for greater success. Second tip comes from dietitian Baszucki Group. She says think of it as a lifestyle, not a diet. With nutritional ketosis, you're changing your body's metabolism and brain function. And if you can include physical activity, even better. That reinforces how this is a full lifestyle change, not just a diet. In Beth's experience, if you're patient and persistent, pretty much everyone experiences some benefits from nutritional ketosis. And then next we hear from Matt Baszucki. He gives us insight from his personal journey of using nutritional ketosis to treat bipolar disorder. And he keeps it simple. Give it a try. If it works, it could work incredibly well and change your life. And then that's your motivation to continue. That was certainly his experience. And he also emphasizes making sure you're prepared ahead of time with food and snacks. Don't get caught off guard. And lastly, Matt says it's okay to make this your identity. It's who you are. Matt feels that treating a mental illness requires 100% commitment. So make your commitment to nutritional ketosis part of who you are. That was his experience, and it's great insight from someone who lived it. Now, our experts also discuss how to handle well-meaning saboteurs, often loving family and friends who just don't quite understand what you're doing, which leads to another top tip of arranging for continued support. Don't try to do this alone. So support could mean, a team of practitioners like a coach and a dietitian, or it could mean family and friends as accountability partners, or even an online group of others going through a similar journey. But the key is don't try to go it alone. And we finished by discussing the question, is a keto diet too hard or too restrictive? Well, the answer is that's not for us to say, and all the experts agree. That's for each individual to decide for themselves. It depends on the benefits they see and how they structure their environment. But the key take-home is don't let anyone tell you that it's too hard. How would they know? You have to give it a try yourself before knowing that. And remember that this isn't something to try on your own, right? Please consult with your physician before using nutritional ketosis to treat any psychiatric symptoms. But these are all fantastic tips from experienced experts. And this is just the beginning. If you want more details about their tips for success, watch our full video at Metabolic Mind. But thank you for watching. I'm Dr. Bret Scher, and we'll see you next time at Metabolic Mind.